Health is a seriously complex set of issues, and what we have is a framework upon which to operate, but it's not a silver bullet. There is no silver bullet. We have to actually do a lot of work to make sure that the global charter can be implemented effectively. It takes actually talking to members of parliament, it takes talking to bureaucracy, it's making sure that everybody understands we have this framework, we can work in a coordinated way, and it's not good enough just to work in a coordinated way with people who are already involved in health. We understand the importance of health in all. We understand the importance of cross-government assessment and health impact assessments and so on. So if we're going to work on protection, promotion, prevention, and we're going to use these tools, these enablers that are described in the Charter, then we have to actually apply them to other public health associations, to local councils. We need to talk to people. We need to make sure that as public health associations we're using our members to spread the word.
With the changing global situation in terms of public health becoming a determinant for economic growth, political situation and several other things, the definition of public health should also relate to the changing global environment in terms of reflecting social determinants and also the current developments related to the Sustainable Development Goal. That's why the World Federation of Public Health Association, in collaboration with the World Health Organization, developed the Global Charter for Public Health. It can be used to really define public health in relation to the changing situation at the global level. That will also help further to improve training, activities, advocacy, and implementation related to public health in the different parts of the world.
What we do know is that it's always a very small amount of a government's budget that goes into prevention. So in Australia, for example, the health spend on prevention is about 2% of the entire budget. And so the huge amount of money is going into tertiary care in our hospitals and secondary care to our medical practitioners. Of course, with the issues of obesity, tobacco, alcohol, and many other issues, unless we actually concentrate on prevention, promotion and protection, then we're going to continue to see an ever-increasing amounts of money. We have an opportunity now, we have the framework with the Global Charter to actually take action now. Because if we take our action now, then we can reduce this increase in expenditure into the future. But it does require a change, an approach. It does require public health associations around the world to influence governments to pay attention and to make sure that we take action on prevention, on protection, on health promotion.